Councilman Glover,
Present.
Councilman Hall,
Present.
Council Lady Porterfield,
Here.
Councilman Pulley,
Present.
and Council Lady Welsh.
Present.
Thank you all so very much for signing on for the meeting today. We have all committee members present. In order to ensure consistency with Governor Lee's Executive Order number 16 regarding electronic meetings, Council Lady Welsh, would you like to make a motion?
I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council and that meeting electronically is necessary to protect health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak.
Second.
Thank you very much. It's been properly moved and seconded. All in favor, say aye.
Aye.
Any opposed? There being none, we're going to move forward with our agenda. First, we have Resolution RS 2022-77, Mendez Hurt Welsh. It accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide the Community Health Access and Navigation in Tennessee program, comprehensive care coordination services to eligible families and children. Now, I still see people from the previous meeting as the participants. Is Mr. Sharp from Health Department on the call? Okay, well, this is one of those grants that we get annually from the Tennessee Department of Health to provide community health access and navigation to deliver as it's said. Yes.
Just move approval.
Second.
Second.
Thank you. All in favor, say aye.
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 Any opposed? Thank you. The next resolution is 2022-78, Hurt and Welsh. This is a contract between the Metro Board of Health and Meharry Medical College, Department of Family and Community Community Medicine to provide clinical experience opportunities for its resident physicians. Again, this is one of those resolutions that we want to continue to support to provide opportunities for those student doctors at Meharry.
Move approval.
Second.
Any discussion? All in favor, say aye.
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 Any opposed? Good, thank you. The third resolution is Resolution 2022-79, Hurt and Welsh approves a contract for the Baby and Me Tobacco-Free program between the Metro Board of Health and the Tennessee Department of Health to support a smoking cessation program, providing counseling and non-cash voucher incentives to pregnant and postpartum women and eligible household members. Can I have a motion?
Move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Thank you. The last resolution we have is Resolution RS 2022-87 by Councilman Hall. It requests the Mayor's Office and the Metro Department of Public Health partner with Meharry Medical College to seek grant funding to track, study, and report on the impact of COVID-19 on minority and rural communities.
Move.
Second.
Second.
Any discussion? Well, Mr. Hall, Councilman Hall, would you like to give us some background on this resolution?
Very briefly. You got me?
Yes.
Okay, very briefly. Back early when this first COVID outbreak started, we were already having conversations and working with Meharry Medical College and Dr. Hildreth on the topic. It was fairly predictable because of information we had received from social services and other areas throughout the last year. So we had already started down this road and we're asking back as early as the second week of March, the 9th to be exact for that specific data to start being collected. Now that it has reached national level, and people see the disproportionate impact, wanting to track that in real time, be able to dissect that and post-mortem after we get this under control, and then create a strategic plan moving forward for rural and urban minority communities so that we are not disproportionately impacted again. And so Dr. Hildreth has already put in a ton of work on this. You may have seen on national news, the grant application is being discussed across the country. He's partnered with 4 other medical colleges and institutions, and they're looking at moving forward on this as soon as possible.
Okay. Any questions regarding this resolution?
Just a comment, if I may, Madam Chair.
Okay.
Thank you, Councilman Hall. I mean, I think this is a big question. And so I appreciate you taking the initiative to look into this.
Well, I appreciate it very much. I'm a little unique in a lot of ways when it comes to District 1, and one of them being is it is, you know, wholly either rural or urban and minority. And so those are the two groups who are most disproportionately impacted and share those similar traits and across the board. And so this will do volumes for areas of this city like mine, and other places hopefully will follow suit.
Thank you, sir.
So I have a question. The resolution.
I have a question myself.
Okay, just 1 second, if you would, Councilman Pulley. It says it requests the mayor's office and the Metro Department of Public Health to partner. What is it that would be required of the mayor's office and the Metro Department of Health to this partnership?
So far, that would include all of the data that's already being collected, because Meharry and Dr. Hildreth already is part of the task force and working with them currently. So it would just keep that same level of participation through this process so that each group is getting the information in real time and able to work on it. And everything that Meharry does will automatically come back and be disseminated through the mayor's office and the health department.
Okay, Councilman Pulley.
Yeah, just, I appreciate where the councilman's headed with this, and we all understand the disparity that we're dealing with. I'm just, a couple of questions. One, is this a binding resolution, or is this asking the mayor's office to do this? That'd be my first question.
It is asking the mayor's office to do this in the health department, but because of the ongoing conversation and participation that's happened between the three, they're all in agreement that this is something that they would like to move on. Harry, even
just so it's not too taxing on your own network, because some people don't have a very strong network at their houses. If they have video on from everybody, it just sucks more.
Hello, I didn't quite hear that.
I think there's been some kind of mix up. I think another committee was being heard in our committee.
Oh, okay.
There's the users. Go ahead.
All right, I'm ready for my, can you hear me, Madam Chair?
Yes, I can, but I didn't get the answer whether this was binding or whether it was just a request.
Can you hear me? It's simply a request.
Okay.
All right. Yeah, I just, there's a couple other, one other thing that was concerning to me is I talked with Dr. Hildreth this afternoon, and he is just really pleased with the level of cooperation that's going on with the task force and the mayor's office, and every one of his recommendations has been adopted. So, he's kind of caught in the middle on this resolution as to whether or not it's necessary. So I just want to make sure that we're not putting our toe in something that is unnecessary if all this is currently ongoing and will continue to be ongoing, whether we pass this or not.
Well, to that point, it was ongoing because we initiated it through Meharry and Dr. Hildreth. And the partnership that Dr. Hildreth has with my operator for Knowles Assisted Living already sought out and found the grant information that would be necessary for us to approach. And again, because as far back on March the 9th, we had already started 30 days ahead of everybody else asking for this information and data to be collected. What you're seeing through the task force isn't task force data that's being collected. It's information that's just being shared with them from other entities, from the CDC, from the state and other areas. That's why every time the caucus or someone has asked for that data, it took so long to get any response. And then the response of being, we're working on that, we're putting it together. And that's because it has not been a focal point until now. But we had already started to collect that data, and this just allows Meharry to, as we flatten that curve and move in a different direction, allows them to continue that research and track those numbers.
Okay. I have no further questions.
Okay, any other discussion? Those in
Lady, may I be, Council Lady, this is Councilwoman Porterfield, may I be recognized?
Absolutely.
Thank you so much. I just would like to commend Councilman Hall for this resolution. I asked our committee members to please support this. There has been data nationwide that has discussed African Americans disproportionately being impacted by coronavirus, and we have been making requests to the team and to the mayor's office about getting this data. Data is needed so that we can look to see how we can slow this down in communities that are being disproportionately affected. And just today, the heat map came out showing that Southeast Nashville and Antioch has a good amount of the cases. Like, we are the hottest area. And when asked about that, they said that a big part of it was because of our immigrant communities that are in this particular area. We have requested more interpretation services that when the mayor is sharing this information, that in addition to sharing it out in Spanish, they're sharing it out in other languages as well. And as of now, we're hoping that will still go forward. But until we have good, solid data about who is being tested and how this is disproportionately impacting one community over the other, we won't have a good way to slow this down in the communities where it is moving more quickly and where the impacts are being more deadly. So I ask that the committee votes in favor of this and supports this so that we can get the information that we need to help keep all of us safe.
Well, thank you, Council Lady Porterfield. And I agree with everything that you're saying in terms of the data, driving the data, and everything that needs to be done in order for us to flatten the curve. The concern I think that I have is something that Councilman Pulley said in terms of Dr. Hildreth, that he's been on the ground from day one with the mayor. And I would not want us to do anything to overshadow any work that he's already doing, and making sure that that relationship continues and they see the trust in him and carry forth with that. So considering that this is just a request and not necessarily binding, I do think that we probably can move forward with it, just to make sure that they see the support that the Health and Hospitals Social Services Committee has in favor of them collecting such data and utilizing it for the purposes as we move forward. So with that, I am prepared to take a vote if there's any other communications or discussion. There being none, all in favor say aye.
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 I only heard two ayes.
Aye.
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 Any opposed? Thank you very much. I think the ayes have it, and I think it was all unanimous on every resolution that we had. And that concludes our agenda for health, hospitals, and social services. So again, I thank you for your time, and I would entertain a motion to adjourn.
So moved.
Second.
Second.
Thank you very much.